Okay, nasolabial folds, Marionette folds, these are things which patients typically present to an aesthetic clinic with. That is what they see as they age, particularly female patients as they get older, and that's what they come presenting with, wanting to be improved. So when we think about filler and what we can do with filler in terms of improving both of these things, you really have to pick your battles. So if you've got a patient who is under volumized, who's lost volume in their face, if we take nasolabial folds to start with, the reason that these are getting deeper in general with age is because of loss of deep fat, particularly in the mid-face, specifically the deep medial cheek fat, and also the deeper fat pads in the lateral cheek. As this volume is lost, you start to get, superficial fat, particularly the superficial nasolabial fat, beginning to win the battle. And as a result of that, you get descent of the midface and deepening of the nasolabial folds. So in a case of someone who is losing volume or is under volumized, generally for whatever reason, replacing or adding volume in the midface and the lateral cheek will improve the appearance of the nasolabial folds. Now, a little caveat to that: if I've got someone who is aging and they already have plenty of volume in their lateral cheek and their midface, this is tricky in terms of filler. Adding volume to the midface or lateral cheek in someone who's already adequately volumized is just going to make them look silly, you're basically kind of robbing Peter to pay Paul. So if you've got someone who's got deepening nasolabial folds and they already have volume in their midface and their lateral cheek, your options are limited. For me, I will look non-surgically to things like radiofrequency skin tightening, like Morpheus 8 being one example. And then, the other options, depending on the exact nature, surgery, may well be the answer for these patients in terms of the degree of improvement that they're seeking. The same, to an extent, goes with the lower face and Marionette folds. So remember, as we age, we get bony change, we get deep fat change, all the things that we know about the aging process. And when we think about Marionette folds, it is descent of superficial jowl fat really that is driving the appearance of Marionette folds on the jowls. And in certain situations, if you've got a patient who's under volumized in their mid and upper face, treating those first will often lead to some indirect improvement in the lower face. And then there are some things that we can do with filler, depending on the severity, to camouflage the lower face in terms of improving the appearance of the Marionette folds. So, you've really got to try and pick your battles. Think about the under volumized patients. Those are the ones that with filler we can do really well. If volume is okay and we're still seeing, deepening Marionette nasolabial folds, we've got to be thinking about doing something to the superficial fat non-surgically. So that's going to be radiofrequency skin tightening, some kind of energy-based modality. And outside of that, for very significant improvements, particularly in terms of the lower face, facelift surgery will always be the gold standard. I hope you enjoyed this content. If you did, hit like, subscribe and share to see a bit more.